I'm Heather Sue Rosen, and I'm a medical sociologist. This is Medical Sociology 101, where I cover the basics for free. Today, I'll be answering the question, what is medical sociology, and how is it distinct from other approaches to studying medicine, health, illness, disability, and healthcare? Medical sociology is both a social science and a health science. It is one of the social scientific approaches to studying topics in health science. So, how is the sociological approach to studying topics in medicine, health, illness, and disability distinct from other approaches to examining these topics? Well, medical sociologists study health, illness, and healthcare in terms of social problems and social factors. They are not interested in individual issues, nor are they interested in biological or cognitive factors independent of social factors. Now, it's important to note that social problems do in fact impact individuals, but sociologists aren't interested in this impact to the individual as much as they're interested in the shared impacts of social problems across groups of individuals. Sociology is not always useful for understanding personal experience. However, sociological research can give insight as to whether your experience is similar to experiences of other people with shared characteristics. So instead of asking something like, why does this individual patient have this experience? A medical sociologist might instead ask, are there characteristics shared by many patients with this experience which may predispose an individual to have said experience? So here, not asking why this individual patient has the experience, but why does this group of patients have this experience while another group maybe does not? Medical sociology demonstrates that things like likelihood of health or illness, experiences and perceptions of medicine, health, illness, and disability, who provides healthcare, how healthcare is provided, and to whom it is provided, and institutional aspects of the healthcare system itself are not random, but instead are shaped by social factors. So medical problems become social problems when they are shared by many individuals with some similar characteristic, experience, or circumstance. And that's Medical Sociology 101 with Prof. Rosen.